Hi there, this is Mark Ittleman, speech-language pathologist and author of The Teaching of Talking and the Teaching of Talking video training. This blog is about remembering. And you might go, okay, Mark, remembering what? And I'll say to you, remembering names, because that's something all of us know and all of us realize. We all sometimes have challenges with names, and why this is somewhat similar to those who have aphasia, who also have difficulty remembering names. Names of words, names of people, names of specific things they need. And so that's the topic of our conversation today, why people have difficulty remembering names and what some of the important concepts are. You know, the other day I was thinking about memory and recall, which is a major factor in speech and language loss after aphasia. I remarked to a friend who told me that he had great difficulty remembering names. He told me that as soon as he hears a name, it flies out the window of his brain. I've heard other people remark about that phenomena, and that's very similar to how aphasia works. But usually with aphasia, it's hundreds of times worse. However, as we all know, there is a discipline to remembering names, just as there is a discipline in speech and language stimulation with those who suffer from a stroke, aphasia, or brain injury. Have you ever noticed that often our memory ability has something to do with the importance we hold for whatever it is we wish to remember? Have you ever met someone and you saw them, and there was a part of you deep inside your head that went, this person's not very important to me, so you really didn't bother to remember the name, and therefore you didn't. I have found personally, and I've observed in others, that the more important the person is to us, the easier it is to remember their name, since there is a payoff in remembering the name. Now, there are those who believe that remembering names is a very crucial aspect of living. Those who place great emphasis on their ability to remember names often do those little things, those little behaviors each and every day to assure that their memory and recall are forthcoming for a person's name. But realize it starts with the level of importance for remembering names. Now, if you believe brushing your teeth is important, well, for some reason you do it every day. Likewise, if you believe that following the speed limit is important, then while you're driving down the road, most of the time you're within the speed limit. It just goes to show, whatever we consider important, we pretty much follow whatever it is that we think will be necessary. The value in remembering names is very high for many people, but for others, it isn't very important. Likewise, the same principle applies to speech therapy and caregiver training. It is a discipline. Knowing what to do to help your loved one or client speak again. One must take the time to learn the principles of speech and language stimulation and then apply those principles. Now, what are the key factors in remembering names, and likewise, remembering words for those who have aphasia? Number 1, a sincere desire to obtain the skills in both remembering names or improving speech, and to practice those skills. Number 2, repeating the skills every day at every opportunity. Number 3, paying attention in the interaction when speaking, stopping what you are doing and stopping what you're thinking to focus on the other person, and taking the time to obtain and share the necessary information. Another key concept, repetition. Any new name or any new vocabulary, whether it's a single word, a phrase, or an expression, must be repeated out loud. And it must be repeated out loud often for it to be absorbed for later recall. Now, never be afraid to ask if you have forgotten the name or the word or the phrase, and then repeating it again out loud. Finding a way to associate a name with a face or an individual physical characteristic is important. Now, therefore, if you're going to remember a person's name, look at that person and see what the most observable physical characteristic is. And then, whatever you decide to pair in your memory with that person's name, put it right there on that person's physical characteristic that you've identified. Now, I met Gloria the other day, and it's very easy for me to remember her name because Gloria was the name of a song that I once knew and still do know it, and it was always one of my favorite songs. So now every time I see her, I think of the song Gloria. Likewise, we have a pet sitter here, and her name is Peggy. Now, Peggy is very big. She's a big woman, and she's very stout, and I've associated the name of an animal with her name, and I never miss her name. And memory requires a little bit of work, a little bit of association, a little bit of repetition, and most of all, it requires that we hold remembering a person's name or remembering a word or a phrase as something that's very, very, very important. Memory for a name, like the memory for words in speaking, is something that can almost always improve by following specific methods and principles in a comfortable and non-threatening environment and not being confrontational in your approach. People who have difficulty speaking already are somewhat stressed because of the fact that they are not confident in their ability to express words or names or phrases or sentences for that matter. If you confront them, like some techniques in therapy, it causes them to feel like they're being put on the spot or they have to perform. Memory never works very well under those circumstances. Memory is always much better when it's stimulated in a comfortable, relaxed, conversational environment where a person is free to speak their mind without thinking or having to think that they have to perform or get it right. Just that concept quite often can interfere with a person's ability to recall. This is Mark Idelman, speech-language pathologist, sharing with you today some concepts about memory and aphasia, and of course the ability to remember names. We'll have another blog about this soon, and thank you for taking the time to listen to this blog, and I hope that if you would like some more information about talking or helping your loved one speak better, that you'll click the hyperlink below. Thank you very much and have a great day.